Medicaid is making headlines in 2025, and for good reason. As one of the largest healthcare programs in the United States, covering over 90 million low-income Americans, Medicaid is at the center of significant changes this year. From shifting enrollment trends to rising costs and policy reforms, let's dive into why Medicaid is trending and what it means for millions of Americans. First, let's talk about enrollment. After reaching record highs during the COVID-19 pandemic, Medicaid enrollment is now declining. In 2024, enrollment dropped by 7.5%, and it's expected to fall another 4.4% in 2025. This decline is largely due to the end of pandemic-era policies, such as continuous enrollment, which allowed millions to stay covered during the public health emergency. Now, states are unwinding these policies, leading to millions being disenrolled. However, despite these declines, Medicaid enrollment remains higher than pre-pandemic levels, with over 8 million more people covered than in early 2020. On the spending side, Medicaid costs are rising. Total spending grew by 5.5% in 2024 and is projected to increase by 3.9% in 2025. States are facing upward pressures from inflation, workforce shortages, and the higher healthcare needs of those who retained coverage. At the same time, state spending is expected to grow by 7% as federal pandemic funding phases out. This puts pressure on state budgets, forcing tough decisions about benefits, provider rates, and program sustainability. 2025 also brings significant policy changes. With a new administration in Washington, Medicaid is likely to see reforms aimed at reducing federal spending. Proposals include imposing work requirements, capping federal funding, and reducing the federal share of costs for Medicaid expansion. These changes could fundamentally alter how Medicaid operates, potentially leading to coverage losses and reduced benefits for millions. Another challenge is the growing demand for long-term care. As the population ages, Medicaid, already the largest payer of long-term care, faces increasing costs. Enhanced federal funding for home and community-based services, introduced during the pandemic, is set to expire in 2025. Without this support, states may struggle to maintain these critical services, leaving vulnerable populations at risk. Despite these challenges, there are opportunities for innovation. States are expanding coverage for mental health and substance use disorder treatments, as well as new therapies like GLP-1 agonists for obesity and diabetes. These treatments have the potential to improve health outcomes and reduce long-term costs, though their high prices remain a concern. Technology is also playing a key role. Artificial intelligence and data analytics are being used to streamline administrative tasks, improve payment accuracy, and enhance patient care. While challenges like data privacy remain, these tools offer hope for a more efficient and effective Medicaid system. Medicaid is at a crossroads in 2025. While challenges like rising costs and policy changes loom, there's also potential for meaningful progress. By addressing workforce shortages, leveraging technology, and prioritizing health equity, Medicaid can continue to serve as a lifeline for millions of Americans. As we navigate this pivotal year, one thing is clear: the future of Medicaid will shape the future of healthcare for us all.